Well, we have a special guest with us today. We're talking to Dr. Mark Hiatt, Director of the Neonatal Intensive Care Unit at the Children's Hospital at St. Peter's University Hospital about the health issues that infants may face when they're born premature. Doctor, thank you so much for joining us this morning.
Well, Molly, thank you for inviting me. I'm delighted to be here.
Awesome. So tell me, what unique health problems are faced by the premature infants?
Well, I'm really very happy to say that the majority of premature infants throughout the spectrum of gestation actually do very well. And they, most of them go home with their families and go on to meet their biologic and neurologic potentials and live a happy and productive life. Many babies who are extremely premature, what we call the very low birth weight infant, less than 1,500 grams or 3 pounds, 3 ounces, as they get those babies, as they're born smaller and less mature, have many more challenges. And they have challenges in the neonatal unit for survival and complications, and some of them have challenges when they go home. It is really gestational age dependent. A normal pregnancy is 40 weeks. And babies who are born less than 28 weeks all the way down to, say, around 23 weeks, that group of babies are the ones that provide us with the most challenges and have who have the most health problems.
And when can you expect to take your baby home?
Unlike many places in the hospital where you might stay for 3 days or 4 days and then you leave, some of our patients will stay in the NICU for 60 or 70 days. And if the families become, we become part of their family and they become part of our family during that time, but eventually they want to go home and we want to send them home. And parents almost invariably ask, when, even on the first day, when is my baby going to be ready to go home? And we give them a kind of a matrix so they'll understand.
We're going to actually pop some bullet points up on this subject. Can you talk to us a little bit about the normal breathing pattern, the eating and gaining weight?
Most parents are delighted to learn that their babies don't have to stay to their due date. So if you're, baby, you don't have to stay to your 40 weeks. It's usually 2 to 3 weeks before the due date, so they're happy about that. And we tell them when their child has a normal breathing pattern, doesn't need support, doesn't have pauses in their breathing, like which is something that premature babies are prone to, or have difficulty breathing, and they're breathing normally when they're eating. And which seems like such a simple, straightforward thing, but babies are born before they even learn how to suck and breathe and swallow at the same time. So when they're able to eat, either through the breast or the bottle, and gaining weight, when they can maintain their temperature without being in an incubator. Babies are born not like a chubby full-term baby, but a premature baby is born very scrawny, without any body fat, and they need to be in an incubator to keep their temperature. So
and they have the completed screenings also.
Right, and they need to live outside the incubator, and they need to be around 2,000 grams, which is 4 pounds and about 4.5 ounces.
Thank you so much for joining us today.